2. In this presentation, we are going to discuss hematologic and lymphatic system function, data collection, and therapeutic measures. Let's take a look at the hematological and lymphatic systems, which are closely linked in the body. The hematological system includes the bone marrow and blood with its components. Bone marrow is the spongy tissue inside bones where new blood cells are made. These include red blood cells, which carry oxygen, white blood cells, which fight infection, and platelets, which help with clotting. Blood plasma also carries nutrients, hormones, and waste products. The lymphatic system works alongside the blood system, but has its own unique role. Lymph nodes act like little filters that trap bacteria, viruses, and abnormal cells. Lymph nodules are small clusters of immune tissue found in places like the tonsils. Lymph vessels are similar to blood vessels, but instead of blood, they carry lymph, a clear fluid full of immune cells. This system is vital for fluid balance and fighting infection. Together, these two systems make sure our bodies can deliver oxygen and nutrients, remove waste, and defend against disease. Understanding these systems is key for recognizing how illness and infection affect the body. Let's look at blood. Blood is made of plasma and formed elements. In the next slides, we are going to learn more about plasma and formed elements and break them down into smaller components. Plasma makes up about 55% of blood volume. Plasma is a clear extracellular matrix that acts as a transporting medium, moving nutrients, hormones, waste products, and proteins throughout the body. Plasma is mostly water, around 91%, but it also contains important proteins. These include albumin, which helps maintain fluid balance by keeping water inside blood vessels, and globulins, alpha, beta, and gamma, that carry substances and play a role in immune defense. Plasma also contains clotting factors, which are critical in preventing excessive bleeding. If we remove clotting factors, what's left is serum, which is still used in many lab tests. Plasma's functions include transporting substances, maintaining body temperature by distributing heat, and regulating pH so the body's environment stays stable. This shows how blood is not just about red blood cells, but also about this fluid medium that supports circulation and homeostasis. Now let's look at the formed elements, which make up the cellular portion of blood. The majority are red blood cells, which are the heaviest and sink to the bottom when blood is separated in a test tube. Red blood cells carry hemoglobin, and their main job is transporting oxygen to tissues and removing carbon dioxide. Above the red blood cells is a thin layer called the buffy coat, which contains white blood cells and platelets. White blood cells, or WBCs, are the body's defenders against infection and illness. They come in several types, like neutrophils, lymphocytes, monocytes, eosinophils, and basophils, each with specialized immune functions. Platelets, or PLTs, are small cell fragments that are essential for blood clotting. Without platelets, even minor injuries could lead to severe bleeding. So when you look at blood as a whole, plasma provides the transport and balance, while red blood cells, white blood cells, and platelets carry out critical functions of oxygen delivery, immunity, and clotting. Together, this makes blood one of the most important connective tissues in the body. Now let's focus more closely on red blood cells, which are the majority of the formed elements in blood. Red blood cells are produced in the bone marrow and begin as immature cells called reticulocytes. Normally, only a small number of reticulocytes are found in circulating blood, but if the body is losing blood or trying to make more, the count may rise. As they mature, red blood cells, also called erythrocytes, take on a unique biconcave shape. This means they are indented in the center, which gives them more surface area to carry oxygen. Mature red blood cells do not have a nucleus, which allows them to pack in more hemoglobin. Each red blood cell has a lifespan of about 120 days. Their main job is to transport oxygen, which is carried by hemoglobin, the iron-rich protein inside them. Oxygen binds to the iron in hemoglobin, and this bond is what delivers oxygen to tissues throughout the body. The oxygen-carrying capacity of blood depends on two things: the amount of hemoglobin and iron in each red blood cell, and the number of red blood cells in circulation. Red blood cell production depends on good nutrition, especially protein, iron, folic acid, and vitamin B12. Without these, the body can develop anemia, leading to fatigue and poor oxygen delivery. Finally, red blood cells can be destroyed by a process called hemolysis. This can happen naturally at the end of their lifespan, but also with certain diseases, transfusion reactions, or mechanical stress. So, red blood cells are the body's oxygen carriers, and their structure, production, and survival are critical to keeping tissues alive and healthy. White blood cells are also known as leukocytes. Unlike red blood cells, which primarily carry oxygen, white blood cells are the body's defense system, protecting against infection and playing a central role in the immune and inflammatory response. All white blood cells are produced in the bone marrow, but they have different jobs once they enter circulation. Neutrophils are the most common type. They respond quickly to bacterial infections and also help with some viral defense. They are like the first responders of the immune system. Eosinophils fight against parasites and play a big role in allergic reactions. They are especially active in conditions like asthma or seasonal allergies. Basophils release histamine, which causes inflammation and narrows airways during allergic reactions. Although they are the least common type of white blood cell, they play an important role in hypersensitivity reactions. Lymphocytes come in two main types. B cells make antibodies, which are proteins that specifically target and neutralize invaders. T cells recognize and kill specific pathogens or infected cells. They provide long-term targeted immunity. Finally, monocytes are the cleanup crew. They engulf dead cells, debris, and pathogens by a process called phagocytosis. When monocytes leave the blood and enter tissues, they become macrophages, which continue the defense and cleanup process. Together, the different types of white blood cells form a team that detects, attacks, and remembers infections, protecting us from disease. Unlike red or white blood cells, platelets are actually small fragments of larger bone marrow cells called megakaryocytes. They don't have a nucleus, but they are packed with chemicals that are essential for hemostasis, which means stopping bleeding. When a blood vessel is injured, the first response is a vascular spasm, where the vessel constricts to slow blood loss. Next, platelets stick to the site of injury and to each other, forming what we call a platelet plug. This is the beginning of a clot. At the same time, platelets release chemicals that trigger the clotting cascade, activating clotting factors in plasma that lead to a strong, stable blood clot. This process prevents excessive bleeding but must also be carefully balanced, because too much clotting can cause dangerous conditions like strokes, heart attacks, or pulmonary embolisms. Together, plasma, red blood cells, white blood cells, and platelets form the complete picture of blood. Plasma transports substances and regulates balance. Red blood cells carry oxygen. White blood cells defend against infection. Platelets stop bleeding. This is why blood is considered one of the most vital tissues in the body. Let's look at some of the common blood tests and what they tell us about a patient's health. First is the red blood cell count. If the count is elevated, it often means the body has been under chronic hypoxia, such as in patients with long-term lung disease or living at high altitude. A low red blood cell count, on the other hand, points to anemia or blood loss. Next is hematocrit, or HCT, which measures the percentage of blood volume made up by red blood cells. A high hematocrit may indicate dehydration because plasma is reduced, or chronic hypoxia. A low hematocrit is consistent with anemia or blood loss. Hemoglobin, or HGB, reflects the oxygen-carrying capacity of the blood. It rises in chronic hypoxia, since the body is trying to carry more oxygen, and falls with anemia or blood loss, just like red blood cells and hematocrit. Finally, we have reticulocytes, which are immature red blood cells. When their number is high, it usually means the body is responding to anemia or blood loss by making more red blood cells. But if reticulocyte counts are low, it signals a problem with red blood cell production in the bone marrow, such as a nutritional deficiency or bone marrow suppression. As nurses, it's important to understand these values because they give us insight into whether a patient's anemia is caused by blood loss, production problems, or destruction of red blood cells. These values guide both diagnosis and treatment. Now let's look at white blood cell lab values and how they help us interpret what's happening in the body. The total white blood cell count increases with infection, but to get a clearer picture, we need to look at the different types of white blood cells. Neutrophils are usually the first line of defense against bacteria. When neutrophils are high, it suggests a bacterial infection or inflammation. If we see many immature neutrophils, called bands, this is called a left shift, and it often means the body is fighting a severe active infection. Eosinophils are most often elevated in allergic reactions or parasitic infections. They can also be increased in some leukemias. A low eosinophil count is less common but may occur in severe infections or after corticosteroid use. Basophils are the least common type of white blood cell, but when they are elevated, it can indicate hyperthyroidism, certain bone marrow disorders, or chronic inflammatory conditions such as ulcerative colitis. They release histamine and play a role in allergic responses. Lymphocytes are most often elevated in viral infections like mononucleosis or hepatitis. They can also rise in some chronic bacterial infections or leukemias. When lymphocytes are low, it may mean the patient has an immune deficiency or is receiving immunosuppressive therapy such as steroids. Monocytes increase in chronic inflammatory disorders like tuberculosis, autoimmune diseases, or during recovery from acute infection. They can also be elevated in certain leukemias. As nurses, it's important to look not only at the total white blood cell count, but also at the differential, which breaks down the percentages of each type. This helps guide us toward whether the patient is fighting bacteria, a virus, an allergy, a parasite, or possibly a more serious condition like leukemia. Finally, let's look at platelet lab values. Platelets, or thrombocytes, are essential for blood clotting and hemostasis. When platelet counts are elevated, this is called thrombocytosis. It may happen temporarily after trauma, inflammation, or surgery, or in conditions where the bone marrow produces too many platelets. High platelet counts can increase the risk of clotting problems, such as deep vein thrombosis or stroke. When platelet counts are low, this is called thrombocytopenia. Causes include blood disorders, bone marrow suppression, chemotherapy, sepsis, or autoimmune conditions. Thrombocytopenia significantly increases the risk of bleeding, even from minor injuries. For nurses, recognizing platelet abnormalities is critical. If a patient has low platelets, we need to monitor closely for bleeding gums, nosebleeds, bruising, or blood in urine or stool. If they have high platelets, we watch for signs of clot formation, such as swelling, pain in the legs, or sudden shortness of breath. So when you put it all together, red blood cells, hemoglobin, hematocrit, and reticulocytes tell us about oxygen carrying capacity and anemia. White blood cells and the differential tell us about infection and immune response. Platelets tell us about clotting ability. These lab values are some of the most common tests you'll see in clinical practice, and they give a window into how the blood is functioning. The lymphatic system has two main jobs: returning tissue fluid to the blood to maintain volume and blood pressure, protecting the body against infection and foreign material. The system includes several important structures. Lymph itself is the clear tissue fluid that drains from tissues into lymphatic vessels. It helps maintain blood volume and pressure. Lymph nodes are small bean-shaped structures scattered along lymphatic vessels. They filter lymph and trap pathogens. Inside, immune cells like lymphocytes and macrophages fight infection. Lymph nodules are smaller clusters of lymph tissue, like the tonsils in the throat, which guard against pathogens entering through the mouth and nose. Lymph vessels and capillaries collect excess tissue fluid and return it to the bloodstream, preventing edema. The spleen is the largest lymphatic organ. It filters blood, recycles old red blood cells, stores platelets, and houses B cells, T cells, and macrophages. Even though it's considered non-vital, removal of the spleen increases infection risk. The red bone marrow produces blood cells, including lymphocytes. The thymus is where T lymphocytes mature and become functional, especially during childhood and adolescence. Together, these structures form a network that not only balances body fluids, but also provides strong immune defense against pathogens. This diagram shows the lymphatic system, which works closely with the circulatory and immune systems to protect the body. This is a good opportunity to review all of the components with the visual. At the top, we see the tonsils, which trap pathogens entering through the mouth and nose. The cervical lymph nodes in the neck filter lymph from the head and neck region. The thoracic duct is the largest lymphatic vessel in the body. It drains lymph from most of the body and empties it into the bloodstream. The cisterna chyli, found in the abdomen, is a reservoir that collects lymph from the lower body before sending it upward through the thoracic duct. The thymus, located behind the sternum, is where T lymphocytes mature. It is most active in childhood and shrinks after puberty, but it remains important for immune function. The axillary lymph nodes in the armpits filter lymph from the arms, chest, and breast tissue, which is especially significant in breast cancer spread. The spleen, located in the left upper abdomen, filters blood, removes old red blood cells, and stores platelets and white blood cells. The inguinal lymph nodes, found in the groin, filter lymph from the legs and lower abdomen. The red bone marrow produces all blood cells, including lymphocytes. Finally, the lymphatic vessels, shown throughout the body, collect excess tissue fluid and return it to the bloodstream, preventing edema and maintaining blood pressure. Together, these organs and vessels maintain fluid balance and immune defense, making the lymphatic system a key part of overall health. As people age, both the hematologic and lymphatic systems go through changes that affect overall health. First, the immune response becomes less efficient. Older adults produce fewer and less effective lymphocytes, and T-cell function slows. This makes them more vulnerable to infections, and it also means vaccines may not always give as strong a protection. Second, iron deficiency is common in older adults. Causes include poor diet, reduced absorption in the gut, and chronic blood loss from conditions like ulcers or colon cancer. This deficiency contributes to a higher risk of anemia, which can cause fatigue, weakness, and shortness of breath. Third, erythrocyte production slows. The bone marrow becomes less responsive, which further adds to the risk of anemia. This is why low hemoglobin is a frequent finding in older adults. Finally, plasma volume decreases, meaning there is less circulating fluid in the blood. Combined with a decreased thirst response, this places older adults at higher risk for dehydration, which can quickly lead to confusion, low blood pressure, and falls. So in summary, the aging hematologic and lymphatic systems lead to increased infection risk, higher risk of anemia, and higher risk of dehydration. These are critical points for nursing care, especially when monitoring elderly patients in hospitals, long-term care facilities, or at home. When taking a health history focused on the hematologic and lymphatic systems, there are several key areas to assess. Start with the reason for seeking care. Many patients will present with vague complaints like fatigue or weakness, which are common with anemia or blood disorders. Ask about family history, since many blood disorders such as sickle cell disease or hemophilia are inherited. A diet history is also important, especially because deficiencies in iron, vitamin B12, or folic acid can cause anemia. Review the patient's medications, because drugs such as anticoagulants, chemotherapy agents, or even aspirin can affect bleeding and clotting. Consider occupational exposure. Patients who work with chemicals, radiation, or toxins may be at risk for bone marrow suppression or blood cancers. When discussing symptoms, ask about fatigue and weakness, which are often early signs of anemia. Assess for bleeding tendencies, including nosebleeds, gum bleeding, or heavy menstrual periods. Check for respiratory symptoms, such as shortness of breath, which can occur when hemoglobin is low and oxygen delivery is impaired. Inspect for skin changes. Petechiae are tiny, pinpoint, purplish-red spots caused by capillary bleeding. Ecchymoses are bruises, larger areas of bleeding under the skin. Purpura are even larger hemorrhages that may involve the skin, mucous membranes, or organs. Finally, assess for lymphadenopathy, which is swelling of the lymph nodes and can indicate infection, autoimmune conditions, or blood cancers like lymphoma. As LPNs, thorough health history and symptom recognition are critical for early detection and referral for blood and lymphatic disorders. When doing a physical assessment of patients with suspected hematologic or lymphatic disorders, it's important to link what you observe with potential underlying causes. A fever can indicate poor immune function or active infection, which may be seen in patients with low white blood cells or immune suppression. On the other hand, a subnormal temperature, lower than normal, can occur with overwhelming gram-negative sepsis, which is a very serious sign. If the patient has an elevated heart rate, think about blood loss or anemia. The body compensates for reduced oxygen by increasing circulation. An elevated respiratory rate often goes along with anemia or decreased oxygen delivery. The body is trying to take in more oxygen to make up for what the red blood cells can't carry. Decreased level of consciousness may be caused by hypoxia, high fever, or even intracranial bleeding. This requires immediate attention. Pallor or paleness, especially in the skin or mucous membranes, is a classic sign of anemia. Cyanosis, a bluish discoloration of lips, fingers, or skin, indicates poor oxygenation of red blood cells and requires urgent assessment. Jaundice, or yellowing of the skin and eyes, suggests hemolysis, the breakdown of red blood cells, or liver involvement since bilirubin builds up in the body. Purpura, ecchymoses, or petechiae are skin findings that suggest a bleeding disorder or low platelets. These should always be taken seriously, as they can be signs of bone marrow suppression or clotting abnormalities. Dry or coarse skin can sometimes be seen in anemia, often related to poor circulation and oxygen delivery. Finally, pruritus or itching may indicate a blood or lymph disorder, jaundice, or liver disease. As nurses, your role is to recognize these signs and connect them with possible hematologic causes so that you can alert the provider and ensure timely treatment. When assessing the hematologic and lymphatic systems, the nurse also pays close attention to physical signs found in the nails, skin, abdomen, lymph nodes, and bones. Nails can reveal important clues. Striations or nail ridges may occur in chronic anemia or nutritional deficiencies. Spoon-shaped nails, also called koilonychia, are classic for iron deficiency anemia, where the nails curve upward like a spoon. Clubbing of the fingers indicates long-term hypoxia. It's most often seen in chronic lung disease or heart disease, but may also occur in chronic anemias. Abdominal assessment can also provide clues. High-pitched, tinkling bowel sounds suggest an intestinal obstruction, which can sometimes occur with abdominal cancers or severe illness. Increasing abdominal girth may mean ascites, a collection of fluid in the abdomen. This can result from bleeding disorders, liver disease, or cancers. Lymph nodes are important to palpate. Normally, lymph nodes are small and not tender. If nodes are enlarged, greater than 1 centimeter, or tender, this suggests infection, inflammation, or possibly cancers like lymphoma or metastasis. Sternal tenderness is a red flag. It can indicate the bone marrow is overactive or infiltrated with abnormal cells, as seen in leukemia or other bone marrow disorders. These findings show how much information we can gather simply by careful inspection, palpation, and auscultation during assessment. When caring for patients with hematologic or lymphatic disorders, we often rely on diagnostic tests to guide treatment. The most common are blood tests, including the complete blood cell count, hemoglobin, hematocrit, and platelet count. These give us a snapshot of oxygen-carrying capacity, clotting potential, and immune system health. We also use coagulation studies such as PT, INR, and APTT to evaluate bleeding and clotting risks. Separately, blood typing and RH typing are critical before transfusions, along with cross-matching to ensure donor and recipient compatibility. A more invasive but highly important test is the bone marrow biopsy. This is used to diagnose and monitor blood cancers like leukemia, assess bone marrow function, or detect infections and metastatic tumors. Common biopsy sites include the sternum or iliac crest. It must be done under aseptic conditions to prevent infection. The nurse's role here is vital. You act as a coordinator, ensuring labs and providers are aligned, preparing and positioning the patient, giving prescribed analgesics, and most importantly, monitoring afterward for bleeding or infection. Emotional support is also essential since this test can be anxiety-provoking. As LPNs, understanding these tests helps you prepare the patient, provide support, and recognize complications early. Some specialized diagnostic tests for the lymphatic system include lymphangiography and lymph node biopsy. Lymphangiography involves injecting a dye into the lymphatic vessels and taking X-rays to see how lymph flows through the system. This test can help identify lymphoma, metastatic cancers, or lymphatic blockages. The nurse's role is critical. Apply a pressure dressing and immobilize the limb used for injection. Monitor closely for swelling, circulatory changes, or loss of sensation, which may indicate complications. Educate patients that the dye may temporarily cause a blue tinge in their skin, urine, or stool, which is expected and not harmful. The second test, a lymph node biopsy, is used to determine if an enlarged lymph node is due to infection, inflammation, or malignancy, such as lymphoma. This may be done with a needle aspiration or a surgical excision. Again, the nurse's role includes monitoring the biopsy site for bleeding, drainage, or signs of infection. Providing reassurance and education since patients may be anxious about cancer evaluation. These tests, along with the blood work and bone marrow studies we already covered, give providers the information needed to accurately diagnose hematologic and lymphatic disorders. Nurses play a key role in preparation, monitoring, and emotional support throughout. When talking about blood products, it's important to remember scope of practice. In Ohio, LPNs cannot administer blood or blood products. However, you still need to know what these products are and why they are used, because you will monitor patients who receive them. Packed red blood cells are given for severe anemia or blood loss, restoring oxygen-carrying capacity. Frozen red blood cells are rarely used but can be stored for longer periods and used for patients with rare blood types or antibodies. Platelets are given when a patient has thrombocytopenia, a low platelet count causing bleeding or risk of bleeding. Albumin is a plasma protein. It may be given for hypovolemia due to hypoalbuminemia, which can occur in liver disease, burns, or malnutrition. It helps pull fluid back into the bloodstream by maintaining oncotic pressure. Fresh frozen plasma contains all the clotting factors. It is used for bleeding disorders, clotting deficiencies, or massive transfusions to replace volume and restore coagulation. Finally, cryoprecipitates are a concentrated source of specific clotting factors such as fibrinogen, factor VIII, and von Willebrand factor. These are used when a patient is bleeding because they are missing a specific factor, like in hemophilia or severe hypofibrinogenemia. So while LPNs don't administer these products in Ohio, you play an important role in monitoring vital signs, recognizing transfusion reactions, providing patient teaching, and supporting the RN and healthcare team. When monitoring a patient receiving a blood transfusion, safety is the #1 priority. Always monitor the patient closely during the first 15 minutes, because most serious reactions occur shortly after the transfusion begins. Vital signs must be checked frequently, and any changes should be reported immediately. The first type of complication is a febrile reaction. If the patient's temperature rises more than 1 degree Fahrenheit, stop the transfusion and notify the healthcare provider. This is usually caused by the patient reacting to donor white blood cells or proteins. The second type is an urticarial or allergic reaction. The patient may develop hives, itching, or a rash. Again, the transfusion must be stopped and the healthcare provider notified. These are usually mild, but they can progress, so they are always taken seriously. The most serious complication is a hemolytic reaction, which is rare but life-threatening. It usually happens within minutes of starting the transfusion and is caused by ABO or RH incompatibility, the wrong blood type being given. Signs and symptoms include severe back or chest pain, chills and fever, shortness of breath, nausea and vomiting, a feeling of impending doom, hypotension, shock, and decreased urine output in severe cases, disseminated intravascular coagulation, DIC, where the patient has uncontrolled bleeding from multiple sites. If a hemolytic reaction is suspected, stop the transfusion immediately. Stay with the patient and provide support, notify the healthcare provider, your supervisor, and the blood bank continue monitoring and documenting vital signs and symptoms. Even though LPNs in Ohio cannot initiate or administer transfusions, you may be assigned to monitor patients, so it's essential to recognize these signs early and respond quickly. This ends the presentation. Thank you.